Hello everyone, and welcome to the first lecture of the Clinical Pharmacology Basic Principles class. And this lecture is going to be about the routes of drug administration. So regarding the routes of drug administration, we have two major types of routes. We have the enteral routes and we have the parenteral routes. Regarding the enteral routes, we have three types. We have the oral, we have the sublingual, and we have the buccal route. And those are called enteral because they will go through the mouth. The parenteral routes, on the other hand, there is four of them. There is the intravenous route, there is the intramuscular route, there is the subcutaneous, and there is the intradermal route. And we also have other type of routes. Those include the topical route, the transdermal route, the oral inhalational route, the intranasal route, and we also have the intrathecal slash intraventricular routes, and we finally have the birectum route, which is PR. And we will explain each of those routes in the next slides. So first, let's talk about the oral route. And PO is a Latin abbreviation and it means by mouth, which is also the oral route. And the oral route is considered an enteral type of route. And the oral administration of a drug involves the most complicated absorption process because it goes through many different absorbing surfaces, starting from the mouth until the rectum. We have a lot of absorbing surfaces, and this would make the oral administration is the most complicated regarding the absorption compared to the other routes. And drugs that is taken by the oral route go through the low pH of the stomach, which is about 1.5, and it inactivates a lot of drugs. And to solve this problem, there is a wide range of oral preparations that are available, and those are divided into two main categories. We have the immediate release preparations and we have the extended release preparations. So basically, in the immediate release, there is a coat, enteric coat, that cover the pill. And when the pill goes through the stomach, it will not get affected by the stomach, but when it reaches the intestine, the enteric coating would dissolve and the pill content would be released into the intestine. And with the extended release preparations, the pill have many layers, have many enteric coating layers, and those would dissolve slowly, leading to slower absorption and prolonged duration of action and better compliance and less toxicity compared to the immediate release. Because the pill content is released really slowly, this leads to slower absorption, prolonged duration of action, and better patient compliance compared to the immediate release preparations. Example for the extended release preparations is with the morphine. So the morphine, the immediate release preparation, would have half-life of 2 to 4 hours, and the patient has to take the morphine 6 times daily. But if we give the patient the extended release one, the half-life would extend to 6 to 12 hours, and the patient would need to take the pill for 2 times only. So the advantages of the oral route include that the drug is easily self-administered by the patient, and toxicities and overdose may be overcome with antidotes like activated charcoal, that when the patient took the wrong dose, we can give them the activated charcoal, make them vomit the stomach content, and that we would avoid the toxicity. And it is also economical because compared to the other routes like the intravenous route, we have to place a cannula into the patient arm to give them the drug, while with the oral route, we just give the patient the tablet and they swallow it, so it is economical compared to the other routes. Regarding the disadvantages, those include limited absorption of the drug, to some drugs, depending on the molecular weight and other factors that we discuss in the drug absorption. Also, the food will affect the absorption, and also depending on the drug, on the type of drug. The patient compliance is also an important factor because some patients might forget to take the dose and some patients would not comply for other reasons. While with compared to other routes like the intravenous route, we give them the drug, so the compliance would not be an issue. Also, the first pass metabolism, the drugs are taken by the oral route would have the first pass metabolism, which will decrease the dose, and that we will discuss in the next lecture too. Example for the oral route is the amoxicillin tablet. Now let's talk about the sublingual / the buccal routes. The sublingual is when we place the drug under the tongue, and the buccal is when we place the drug between the cheeks and the gums. And the drug is absorbed directly into the circulation. It absorbed directly into the circulation of the mouth and into the main circulation. So it would not go through the GIT tract. And that is the difference compared to the oral route. The advantages of the sublingual and the buccal routes is that we have rapid absorption of the drug, and they would bypass the harsh environment of the GI system, and we would avoid the first pass metabolism associated with the GIT system. The disadvantages, on the other hand, is that the sublingual buccal routes are limited to certain type of drugs that does not cause irritation to the mouth, and also they are limited to drugs that is taken in small doses. An example for the sublingual is the sublingual nitroglycerin, which is a vasodilator. It causes vasodilatation. It is very beneficial in patients who have ischemic heart disease. It would make vasodilatation, and it would relieve the pain and the breathlessness associated with the angina. Now let's talk about the parenteral routes. With the parenteral routes, the drug is introduced directly into the systemic circulation through injecting the drug directly into the veins, what we call intravenous, the subcutaneous tissue, which is the subcutaneous, the muscle, the intramuscular, and the dermis, which is the intradermal. So regarding the skin layers, we have the epidermis, which is the first layer, and then under the epidermis, we have the dermis, and then the subcutaneous tissue, and under that we have the muscles. So epidermis, dermis, subcutaneous tissue, and finally we have the muscle here. So with the intravenous route, there is like veins are going through here, and when we choose the intravenous route, we would insert a cannula into the patient arm, and it would reach into the vein, and we would give the drug intravenously. With the subcutaneous route, we would give the drug into the subcutaneous tissue, and that's what we call subcutaneous. With the intramuscular, we give the drug into the muscle, which is here. And with the dermis or intradermal route, we give the drug into the dermis layer, which is here, and that's what we call intradermal. So the parenteral routes are used for the poorly absorbed drugs from the GI tract, like the heparin, and the unstable drugs in the GI, which like the insulin. They also used for the patients that are unable to take oral medications, like the unconscious patients, and in circumstances requires rapid onset of the drug, and that's in the acutely ill patients. Those require rapid onset of the drug, and we give them the drug parenterally, so it would be faster than the other routes. The advantages of the parenteral routes is that we have better control over the dose. With the oral route, we have a lot of factors affecting the dose. We have the first pass metabolism, we have the different absorbing surfaces, we have the food maybe affect the dose. We have a lot of factors, while with the parenteral routes, all the drug that we are going to give is going to go into the systemic circulation. So we have better control over those. Regarding the disadvantages of the parenteral routes, those include irreversibility, meaning when we give the drug by parenteral route, we can't take the drug back because it is already in the circulation, while comparing with the oral route, we can take the drug back by giving the patient activated charcoal and making the patient vomit the drug. Also, there is pain and there is fear, and there might be local damage associated with the parenteral routes, and there is higher risk of infection. So now let's talk about the intravenous route. The intravenous route is considered parenteral route, and it is the most common parenteral route, and the drug goes directly into the bloodstream. So we're basically injecting the drug into the vein. So it's basically goes directly into the bloodstream. The advantages of the intravenous route is that it has very rapid effect and maximum control over the dose, and it is very ideal for large volumes of fluids and drugs given to patient. The disadvantages, on the other hand, include it is unsuitable for oily substances. We can't give oily substances intravenous. The bolus injection may result in adverse effects like acute heart failure. If we give the patient a lot of fluid, they might have acute heart failure. Most substances must be slowly injected, and because of the hypersensitivity reactions, we need to slowly give the drug into the patient. Also, it requires strict aseptic technique, because we introducing the drug directly into the circulation, and bacteria would lead to infection, so we try to do strict aseptic technique. And there's risk of thrombosis and hemolysis associated with injecting the drug directly into the bloodstream. Examples for the intravenous route is the vancomycin intravenous, which is an antibiotic drug, and the heparin intravenous, which is an anticoagulant. Now let's talk about the intramuscular route. I am for intramuscular, which is into the muscle, and it is also a parenteral route. And the drug injected in the muscle and then diffused into the systemic circulation. And the drugs administered intramuscularly can be either in aqueous solutions or in specialized depot preparations. Aqueous solutions are absorbed rapidly. The specialized depot preparations absorbed slowly, providing sustained dose over an external or extended interval. The advantages of the intramuscular route: it is suitable for oily drugs compared to the intravenous route, which is not suitable for that. And it is preferable if patient must self-administer. It is more preferable than the intravenous route. And disadvantages of the intramuscular route include that it is painful, and the blood creatinine kinase would increase, because when we inject the drug into muscle, there is some muscle fibers that would die, so it would release the creatinine kinase into the circulation, and it would lead to increase of that marker in the circulation. The example for the intramuscular route is the benzathine penicillin, which is also an antibiotic drug. Now let's talk about the subcutaneous route, subcutaneous SC, which is also a parenteral route, and the drug injected into the subcutaneous fat and diffused into the blood after by simple diffusion. And it is slower than the IV route. The advantages of the subcutaneous route is that it minimizes the risk of hemolysis and thrombosis associated with the IV injection, so it is more safe compared to the intravenous route, and it provides constant, slow and sustained effect. Because the drug is slowly absorbed into the circulation, we have constant, slow and sustained effects. The disadvantages of the subcutaneous route is that if the drug causes tissue irritation, this leads to severe pain and necrosis may occur. So this route is not used with the drugs that cause tissue irritation, so there is limited number of drugs that can be used with the subcutaneous route. Examples for the drugs taken subcutaneously: we have the insulin, the subcutaneous insulin, and we have the heparin, the subcutaneous type of heparin. Now for the intradermal route, which is intradermal into the dermis. It is also a parenteral route, and injection into the dermis under the epidermis, and it have the longest absorption time of the parenteral route. It is used for identifying the allergy for a specific drug. So we take that drug and we take a little of the drug and we inject it intradermally, and we see what happened to the skin. If the skin become irritated and become red, this means that this person is allergic to this drug. And if there is no effects whatsoever, this means the person is not allergic for this drug, and we can give them the full dose of the drug intravenously or by oral routes. It is also the intradermal route is very helpful in diagnostic testing for some diseases, such as the tuberculin test to check for the tuberculosis disease. Now let's talk about the oral inhalational route. And the oral inhalational provide rapid delivery of the drug to the lungs, respiratory epithelium. and it is suitable for drugs that are gases, like some anesthetic, like the isoflurane, and those that can be dispersed in an aerosol, like asthma drugs like albuterol. And it is used for respiratory disorders like the asthma and the COPD, and it's also used for anesthesia, like some anesthetic like isoflurane, sevoflurane, and other type of anesthetics. The advantages of the oral inhalational route is that the drug action is as rapid as the IV route, and there is minimal systemic effects. So basically, when we give the drug by the inhalational route, we give it to the lungs, and it is very quickly without any systemic effects, and that's very helpful if the patient have respiratory disorder. So it is very good and rapid and have minimal systemic effects. The disadvantages of the oral inhalational route is that the most addictive route, because the drug can go to the brain quickly. So if the drug is addictive, the patient would get addicted easily by this route. And it is difficult to use inhalers for most people. In fact, there is a studies that suggest that there is 92% of inhaler users that use the inhalers in the wrong way. Now let's talk about the intranasal route. And the intranasal route involves topical administration of the drug directly into the nose. And the drug is put into and across the nasal mucosa, and is either treat the nasal mucosa or go to blood supply and act systemically. And it is mostly used to treat nose disorders like the allergic rhinitis disorder. Now let's talk about the intrathecal and the intraventricular routes. The intrathecal is when we give the drug into the spinal cord, and the intraventricular is when we give the drug into the brain ventricles. And so the drugs are directly given to the cerebrospinal fluid. Because the brain and spinal cord are protected by the blood-brain barrier, it prevents most drugs from going to brain. And that's why we use the intrathecal route to bypass the blood-brain barrier and give the drug directly into the cerebrospinal fluid, where the drug action is needed to work on the brain or spinal cord directly. And it is used when local and rapid effects of drugs are needed, such as if the patient has meningitis or encephalitis, and we need to give them antibiotics directly into the spinal cord or the brain. Or it is used with the if the drug have high molecular weight and we need it can't pass the blood-brain barrier, so we have to give it intrathecally, such as with the high molecular weight antibiotics and with the anti-cancer chemotherapy. We also have the intraarticular route. That's when we give the drug into the joints. So drug injected into the joint space. Example would be the steroid injections given in arthritis to relieve the joint pain and inflammation. So we would give the drug, the steroids directly into the joint, the patient joint, so we would have a very good local effect, reducing the pain and reducing the inflammation. The topical route is when the drug is applied to skin or mucosa, and the action intended to work locally on the skin, eyes or the vagina or other parts of the body. The disadvantage of this route is that some systemic absorption can occur and unsuitable for drugs with high molecular weight or poor lipid solubility, because these drugs can't pass the skin or can't be absorbed into the skin and would not work. Examples for the topical route is the clotrimazole cream, which is used as an antifungal, used for fungal infections on the skin. And the hydrocortisone cream, which is a steroid used to reduce inflammation and treat some type of skin disorders. The transdermal route, on the other hand, is that it is applied to skin, but it crosses the skin into systemic circulation. And the intention here is for the drug to cross the skin, while in the topical route, the intention for the drug to work on the skin. So intradermal route, the drug is cross the skin and enter the systemic blood supply to treat disorders unrelated to the skin. And the advantages of the transdermal route is that it bypasses the first pass effect, and it is convenient and painless, and ideal for drugs that are quickly eliminated, because it would give the drug slowly into the systemic circulation, so it would have long effect. The disadvantages of the transdermal route is that some patients are allergic to patches. So if we give them a patch, a transdermal patch, they would have skin conditions occur to them, allergic skin conditions, and it is limited to drugs that can be taken in small daily doses. Example for that is the nitroglycerin patch that's given for vasodilatation, and the nicotine patch given for people who are willing to quit smoking. So it would give them, it would reduce the addiction, and it would lead to less cigarette smoking. Finally, let's talk about the rectal route. The PR is a Latin abbreviation to means by rectum. In rectal route, the drug is absorbed into rectal mucosa, which 50% of rectal region drainage bypasses the portal circulation, and the portal circulation lead to liver, where the first pass metabolism occur. So it is minimized. So 50% of the dose would have first pass metabolism. Of the dose would have first pass metabolism occur, and the other 50 of the dose would bypass the first pass, so no first pass metabolism. And the rectal route is useful if the patient is vomiting, so we can give them the drug by oral route. So we give them by rectal route, and it is useful if the drug can't be taken orally, and if the patient is unconscious. The disadvantages of the rectal route is that the drug may irritate the rectal mucosa, so it is limited to some drugs that can be taken by rectum. And example, we have the diazepam pyrectum. The diazepam is an anti-seizure medication. So given to people who have seizures, usually they are unconscious, so give them the diazepam by rectum sometimes, and sometimes intravenously. And with that, we reach the end of this video. If you guys want to support this content, please like the videos and subscribe. If you want to support more, you can subscribe to the Patreon, link provided in the description below. With that, we reach the end of this video. Thank you guys for watching, and see you in the next videos. Peace.